Hello, today we're going to talk about thyroid disorder. First, I want to introduce how thyroid hormones are made. Hypothalamus in our brain will secrete the TRH. TRH or thyroid releasing hormone. TRH will stimulate pituitary gland to secrete TSH. TSH is thyroid stimulating hormone, and then TSH will stimulate the thyroid to make T3 and T4, and T3 also called triiodothyroxine, and T4 we call thyroxine. Um, First, I want to talk about hyperthyroid. There are different type of hyperthyroid. For Graves' disease, it's a hyperthyroid disorder, also a autoimmune disorder. Antibody will mimic the body make an antibody that mimics TSH. Then our TSH will increase production of T3 and T4, or pituitary adenomas that increase TSH secretion, and then also T3 negative feedback loop not working. We know that we have negative feedback loop. That means if we have too much of T3 or T4, the loop will tell the pituitary gland to stop making TSH. Also, we have another signal to stimulate hypothalamus stop making or reducing to make TRH. In this case, pituitary adenoma T3 negative feedback is not working. Toxic adenomas is a nodule in the thyroid or a nodule in pituitary gland, which cause increasing THH the production, and of course will increase T3 and T4. Or plumber disease, that's a autoimmune disease. Thyroiditis, this is a cell-limiting inflammation of the thyroid, or hypothyroid, also called by drug. Amiodarone is the number one drug that have side effects that cause increase of thyroid hormone if we use amiodarone for a long time, or we take thyroid hormone treatment for a long time or overdose without checking the level of thyroid hormone. Diagnosed, we diagnosed by T4, free T4. In this case, T4 will be increased, or THH decrease, except in TSH adenoma. In case radioactive iodide uptake elevated, we also usually have increased T3 and T4. That is the case of Graves' disease, or TSH secreting adenoma, or toxic adenoma, or multi-dollar goiter. If radioactive iodide uptake decrease, we have thyroiditis or hormone ingestion. We can also detect antibody, some antibodies such as thyroid stimulating, thyrotropin receptor, thyroperoxidase, thyroglobulin, or thyroid biopsy. What are the symptoms of hyperthyroid? We have heat intolerant patient will show up with the weight loss, increased appetite, voice stir, fine hair, tachycardia, nervousness, insomnia, anxiety, or amenorrhea, or increased metabolism because increased metabolism of estrogen, sweating, exothymos. Treatment. Usually, first line is ablative therapy. For this therapy would be a side effect can be hypothyroidism or surgical resection for adenoma or thyroidectomy. We can treat an hyperthyroid with the anti-thyroid pharmacotherapy. Usually, we use medication in the situation where the patient is waiting for ablative therapy or surgical therapy. We have three main medication. The first medication is propyltyrosine, 50 to 150 milligram 3 times a day. We can reduce to 50 milligram 1 year or thyroid. That means the thyroid level now become normal. A mechanism of action of this medication to block synthesis of thyroid hormone. For pregnant women, they recommend to use methimazole for the first trimester and propyltyrosine for the second trimester and the third. Methimazole. Usually to treat the Graves' disease, we start with 10 to 20 or to 30 milligram oral daily. Once euthyroid, we reduce the dose to 5 to 10 milligram a day. We need to monitor TSH and T3 level during pharmacology therapy. Non-selective beta blocker. The mechanism is to block beta adrenergic receptor. It blocks conversion of T3 and to T4, T4 to T3. Dose 20 to 40 milligram oral 3 times a day to a maximum of 240 to 480 milligram daily. There is a local solution of potassium iodide tablet. This medication used to inhibit the release of thyroid hormone. They are used to reduce the size of gland before the surgery. We can use 120 to 400 milligram 3 times daily. Also, they can be used acutely on thyroid stone.